So my name is Sonia Sobrowski. I'm currently a senior studying biochemistry and psychology. And so Maddie and I got involved with Home Base Initiative by basically we're a part of the Tillman Scholars Program, and what they really do is encourage us to come up with a social venture. So we have a connection to mental health promotion because we both lost a friend to suicide in high school. And so this is a real passion for us, is advocating for mental health, and we decided that this was a perfect platform to do so.
So suicide is the second leading cause of death for adolescents. We specifically look at high school students. And this issue really affected me and Sonia during our high school experience. We had a friend commit suicide our senior year of high school, so about 4 years now. And that's really what brought us to this cause. And looking into it more, we realized that it's not just us. There's a lot of people that have been affected by this, not only suicide, but the causes that lead up to that, such as like depression, anxiety, and things like that. So that's really what caused us to found Home Base Initiative.
So through the Tillman Scholars Program and the support we got from them, as well as our research background in psychology, we decided to tackle the issue of teen suicidality through both like a research-focused approach as well as a social approach. So what Home Base Initiative does, there's two main parts. One is creating an online resource guide to disseminate information that's been gained from the research community about suicidality and give that in a way that's accessible to educators, parents, and students. So those are three really big groups of people that are going to process information in different ways. So our website, homebaseinitiative.org, we have a list of research-backed suicide prevention programs for educators to look through, and if there's something they think applies to their school, they can definitely advocate it to administration. And then we also have some really cool apps and different programs for students to use, just ways to keep up with their mental health, kind of keep in check with themselves, and also tips on how to stay healthy just in general. So exercise is a big thing that promotes mental health. Volunteering is big. Using pets for social support and comfort.
And then the second part is kind of creating our own suicide prevention program, primarily looking at the social risk factors of suicide. So what we noticed putting together the digital resource guide is that a lot of them look at the clinical risk factors such as depression and anxiety, and the social risk factors kind of go overlooked. And so for kids that aren't diagnosed with depression or anxiety or kind of the more clinical side, we wanted to look at how can we best support them, because things like feelings of burdensomeness, isolation, and a lack of a tightly networked school community, those can just as easily lead up to suicide as well as clinical risk factors.
I saw this as a wonderful opportunity that made me very excited and very engaged from the beginning, seeing that these students had such a wonderful, kind vision. I worked with them and mentored them to learn how to identify programs that are scientifically based, that have evidence, programs that are known to work. So we spent quite a few months working together, reviewing the literature, identifying programs, identifying the measures that show that these programs work, and evaluating the content of these programs as a way to think about and begin to conceptualize a redesigned program that would fit in our local schools here in Arizona and potentially across the entire nation. We do have a great problem with suicide. You know, the rate of suicide that we would want is zero. No one should really be taking their lives, you know, and children and, you know, young students should really not be thinking about these types of issues or, you know, this way of ending their life.